certified veterinary technician Sam Sacasa from Vetfolio, and I'm the host of this Tech Takeover edition of Vet2Vet. Diabetes is such a common diagnosis, and the role veterinary technicians and nurses play in helping those patients and the pet owner have the fullest, best life possible despite diabetes, well, it just can't be overstated. Building your confidence and helping pet owners navigate diabetes is so important. Here to share some amazing tips to help you set your pet owners up for success is Ken Yagi, the Chief Veterinary Nursing Officer of the Veterinary Emergency Group. Ken, I know you've seen your fair share of diabetic emergencies, so I'm excited to talk about all the ways we can hopefully help diabetic pets maintain a good quality of life.
Thanks for having me here today. I know that when I think about diabetes mellitus from my experience, I come from an emergency background. And so these patients are the ones that come in shock, they've been vomiting, they have ketones on their breath, and their blood glucose is super high with, sure enough, serum ketones being off the charts. So these patients are hugely rewarding for our team to treat because we're able to get them from this being on brink of death to being able to provide stabilization measures. Sure, there's a hospitalization period with insulin CRIs and monitoring some blood values like electrolytes and blood glucose. But in the end of all of it, we're able to send them home on a longer acting insulin to regulate their blood glucose and achieve maintenance to live a hopefully very meaningful life afterwards. And so as I encountered more and more of these emergency situations that happen on a pretty regular basis, I came to realize that even though emergency medicine is amazing, preventative medicine and preventing them from being in this situation to begin with is the better way to help more animals and save more lives. And so because the best way to save animals is to prevent emergencies from occurring to begin with, all of these conversations that we're having today and this particular talk that we're doing right now is very important to me.
Let's talk a little about initial diagnosis. When we're first trying to either rule out or look into a diabetes diagnosis, what is important for technicians to keep in mind when taking a history?
Yeah, so first of all, it's important for us to be able to recognize signs of diabetes. The clinical signs that you see associated with diabetes could be something like increased thirst and increased urination, or commonly called PUPD, right? That we hear that term often. This happens because the blood glucose levels goes higher than a certain threshold. The excess glucose is not able to be reabsorbed fast enough by the kidneys and is excreted in the urine. And the increased glucose level leaking into the urine is going to pull more water into the bladder and out with the urine through osmotic diuresis, which then in turn leads to the animal being more thirsty because they're even more dehydrated because of the sugar that leaks out in the urine. There could be also an increase in appetite because the animals aren't able to take glucose into the cells to use for production of energy that they normally need to do, which makes the cells feel hungry, which makes the animals feel hungry, and they want to eat more. The animal could be experiencing weight loss, even though the food intake is increased because in order for the animal to find an energy substitute, it actually needs to break down its fat and muscles instead of relying on the sugar that comes from the food and the diet itself. And if the patient is progressed further into diabetes, then they actually may have decreased appetite due to nausea. And of course, veterinary nurses and technicians are the prime people in the team to be collecting the history and noticing these signs. And so here's a tip when taking history and doing it well. There are two kinds of questions that give different results. The first and the recommended way to do this is to ask open-ended questions. Open-ended questions sound like, what's been going on since your last visit? Or tell me about any changes that you've noticed. Open-ended questions encourage the pet owners to tell us what's on the forefront of their mind and describe the issue in their own words through their observations. And this lets us address what's actually worrying them and gives us information that's not biased by our own focus. Because if we ask questions like, has he been urinating more? Then that's a closed-ended question that's going to result in a yes or no answer. And starting with these questions lead to very limited information. And it might also lead the pet owners into thinking, oh yeah, you know what? He has been visiting the litter box a little bit more. So yeah, I think he has been urinating more, and actually might not be true. And so it's just the way that we ask the questions that might suggest giving us the wrong answer. And so think about how you're going to be asking your questions when you're taking the history. And we certainly play a large role in honing in on the relevant information when history taking by starting with open-ended questions and focusing down to more focused, closed-ended questions down the road as you want to get the specific information.
Absolutely. I think that's so important to keep in mind. Once we've learned about the patient, how can we use that information to in turn help guide the owner?
Yeah, I tend to think about this in a simple algorithm that there's three different statuses that guide our focus of our conversation with the pet owners based on what we see with the patient, which can be gotten to by asking these simple questions. The first question to ask ourselves is the patient showing signs of diabetes mellitus? If the answer is yes, then the patient can be labeled a possible diabetic. And the focus of our conversation and the strategy that we employ then becomes these signs that we see and the possibility of diabetes. And then the possible diagnostics that we might need to do in order to confirm or rule out diabetes mellitus. If the patient's not showing signs of diabetes, so the question answer to the first question was no, then the next question to ask is, are there risk factors associated with diabetes seen in this patient? And this is mainly obesity is the risk factor that we think about for type 2 diabetes, especially in cats. If the patient's overweight, then I would call this patient at risk. And discuss weight reduction strategies, such as monitoring their weight, dietary management related to caloric intake, so how much food they're taking in, but also encouraging exercise so that they're expending more energy and they're not going to be gaining weight. And so for cats, these would be things like having cat furniture. Maybe there's exercise wheels. There actually are ones out there that are smart that will allow you to track how much exercise they're doing. Or being able to place food containers that look like mice and have them actually quote unquote hunt these the food for them to hunt the food. And yeah, these things do exist. And the goal here would be to try to mitigate and eliminate the number one risk factor to diabetes mellitus in cats. If the answer to that question of whether the risk factors are present or not was no, then that's great. You have a low-risk patient, but the focus of the conversation here probably still would be employing general strategies to maintain a healthy weight, telling the pet owners that you guys are doing a great job, keep it up, and here's the things to keep in mind.
You spoke about prevention. Once a diabetes diagnosis is made, what can technicians do to help prevent emergency situations like DKA?
Yeah, I think veterinary technicians and nurses serve 5 key roles in their practice to help pet owners take care of their pets. The first thing we are definitely educators. We have the knowledge that lets us explain the situation to the pet owner and the condition that the animal may have, helping them get a good understanding of the disease itself, whether it be the clinical signs, the potential complications, the treatments that we need to provide, et cetera. There's a lot of information there. Second, we are advocates. Our patients, we all know, can't speak for themselves, and that can often lead to the owner not realizing what's going on. And so even though the pet's trying to tell the pet owners something is going on, we're the ones that might be able to bring that to their awareness. And we also advocate on the patient's behalf to our doctors if there are factors that we think that were missed. A third role that we have is that we're a bridge. There might have been questions that the pet owners couldn't ask the doctor or didn't quite understand, but maybe didn't have the opportunity or the courage to ask. And we can serve as bridges to ensure that gap is filled. Fourth role that we have is we're translators. When the doctor explains medical concepts or plans of care that don't quite allow the pet owner to understand very well, then we can actually break it down into a more practical and down-to-earth manner that is understandable by the pet owners. And lastly, and this is an important one, we actually need to be cheerleaders. Working through any kind of pet health issues, especially something like diabetes, is going to be pretty daunting for the pet owner. So while I'll say that diabetes treatment is no cakewalk in any kind of means, it's something that is manageable with appropriate care. And we need to be the ones that say to them, you can do this, and give them the confidence to treat their pet at home, which is going to lead to this healthy, meaningful life for the years. So be an educator, be an advocate, be the bridge, be a translator, and be a cheerleader. You can do this.
So, Ken, you mentioned being an advocate, which I think is so important for veterinary technicians and nurses to always keep in mind. How are veterinary technicians advocates for pets with diabetes?
Yeah, one of the key areas we should be advocating for the patient and the pet owner are things that can improve their quality of life. Within the past few years, I would say, we've seen some advancements in this area with diabetes mellitus treatment that is worth noting. The first one is the existence of a proven once-a-day dosing insulin for most dogs, like Prozinc. Prozinc is a protamine zinc recombinant human insulin. Prozinc insulin is FDA approved for use in both dogs and cats, and is recommended in cats by the American Animal Hospital Association, or AHA. Prozinc insulin is, because it's made with protamine and zinc, it allows the release of insulin to happen in a more controlled, predictable manner, and it'll be available for the body for an extended duration of action. The typical duration of action is 10 to 14 hours in cats and 18 to greater than 24 hours in dogs. And this extended duration of action of Prozinc allows for once-a-day dosing administration in most dogs. But I do want to mention that for cats, it's still twice-a-day dosing. Now, outside of the Prozinc insulin, twice-a-day dosing or BID dosing for dogs is what's prevalent out there for maintenance dosing. And the BID dosing requires the owner to try to be at home at a specific time of the day, going through routine feeding, making sure that they've eaten, preparing the insulin, and giving the shot, which means that the dog is poked twice a day instead of once a day. And so once-a-day dosing has the stress, the lifestyle inconveniences, struggles, and discomfort associated with the insulin administration. So it's a huge improvement in the quality of life. Another advancement has been continuous glucose monitoring devices. While these devices aren't officially approved for use in animals, they are becoming more and more popular out there that is being used by the veterinary community. This is a device that allows a cannula to be inserted under the skin into the interstitial space, and the glucose is measured through that cannula. And so by being able to monitor this interstitial glucose on a consistent basis that correlates very well with blood glucose level, we're able to monitor the patients well. And so with all insulin products, we know that careful patient monitoring to make sure that hypoglycemia or hyperglycemia isn't happening is essential to make sure that we maintain adequate glycemic control and to prevent associated complications. So this device can really help with the patient monitoring, especially during the initial stabilization and regulation phase once the insulin prescription started. So these devices can be used for short-term to long-term glucose level monitoring. It replaces things like blood glucose curves, which is something that's very stressful for the animal because it involves a visit. There's a short hospitalization while we're having the blood samples taken on a regular basis. It's usually once every hour to 2 hours, and we're seeing how the blood glucose level tracks, right? It traces. So these continuous glucose monitoring devices actually allow us to even circumvent stress-related variability in the blood glucose that might happen with something like a blood glucose curve being hospitalized, being handled by veterinary staff members. And so the continuous glucose monitor is becoming more and more popular to help the patient out a lot better. I don't know if this is considered an advancement necessarily, but dietary management is actually one of the mainstays of making sure that diabetes is better controlled, and it can be a difficult task to do at home. So trying to separate out multiple pets, having to make sure that the right animal's eating the right kind of diet and all that might be a little bit hard for the pet owners. So a quick tip here is that while diabetic pets should be on a specific diet, it doesn't harm healthy patients to eat diabetic diets. And so if separating them out, making sure that they're eating the right diet is going to be a little bit difficult, then feeding all of your pets the diabetic diet is okay to do. Now, obviously, it could get a little bit expensive since diabetic diets are a little bit more expensive than normal pet food, but it's just one of the strategies that we can employ if your pet owner is having a hard time managing their diet.
Yeah, I think that you gave really great advice. I'm really excited about those continuing glucose monitoring devices because the glucose curve can be stressful for the patient and for the vet staff, right? You have to set your timer every hour. Once it goes off, even if you're in the middle of something, you have to like remember to go back to it. It's a little bit stressful. So I think that's a great innovation. And just in general, I remember when I first started teching, there was this expectation, I think, for the owner to, adhere to this 12-hour schedule. And that's really hard sometimes, depending on the owner's lifestyle. So I'm just so happy that research has been done to sort of help accommodate the owner's needs a little bit more. It makes me feel like the owners are being heard.
Yeah, hopefully more and more of them will be validated for veterinary use and it becomes a norm and we can use that guilt-free.
Absolutely. Why is it important for veterinary technicians to be knowledgeable about the different insulins available? I know you mentioned Prozinc.
Yeah, there's definitely various types of insulin out there that we need to be aware of so that we can advise the owner more appropriately. And that's really the reason that we need to be aware of it. And there's three different factors that we should be considering. The first one that's pretty important is concentration. There are U100 and U40 insulins out there, which represent different concentrations of insulin. And there's respective syringes that are assigned to each of them that help administer the correct volume to give the right number of units. And this is important because using the wrong kind of syringe is going to lead to some issues. So for example, if you use a U100 syringe for U40 insulin, then it's actually going to lead to a underdosing compared to the intended amount of insulin that we wanted to give. And this one isn't as likely to be harmful since the patient's getting some kind of insulin, just not as much. It'll lead to poor control likely and confusing blood glucose results. The other way around is what's more harmful in that if you use U40 syringes on U100 insulin, that's going to lead to a potential overdose because you're giving more units than you're intending to give. So could this lead to hypoglycemia, animal seizuring because of it, or other neurologic signs like twitching and such? That's the reason why this combination is more harmful. So making sure to match the correct syringe with the right kind of insulin is going to be a very critical piece. Another detail to consider is how the insulin needs to be prepared. Not all insulin should be gently rolled for resuspension like we tend to think, that some actually require some more vigorous shaking in order for it to be resuspended. Some of them are to be left alone. And so it's really important to pay attention to the manufacturer's instructions for each of these products and advising our pet owners appropriately. And then the last one that we've already mentioned, but I want to mention it again, is the duration of action of insulin is a key factor in considering when choosing the type of insulin that we'll be giving for our patients. And each insulin, we mentioned, that has a different duration of action. And so there's twice a day insulin versus once a day insulin out there now. And so I tend to think about the quality of life and the pet owner as well. So for canine patients, thinking about providing the once a day dosing insulin like Prozinc is something to be strongly explored.
So we talked about how veterinary technicians can be advocates for the pet. How can we be advocates for the pet owners?
Veterinary technicians and nurses can further advocate for the pet owners by serving the 5 roles that we talked about before. But additionally, we should be aware that even with our best efforts, all the information that they need to take home might not stick. It's a lot of stuff that we're going to be covering with them. They're going to be unfamiliar with it, even though we might think it's pretty simple information since we do it all the time. So a tip here is to share educational material for them to review at home that they can be reminded of each of these factors for. So for example, the training of the pet owner in providing insulin at home might start with a demonstration of insulin administration at your clinic. That means you would be showing them how to do it and you demonstrate it yourself. Or the next step would be that you might use like a fluid bag or a stuffed animal or something like that to have them demonstrate the giving of the insulin. And it won't be uncommon that the pet owners have trouble giving insulin consistently at home? Is it that they don't feel confident enough to attempt the administration of the insulin? Do they need to team up with a family member in order to make it a little bit easier? Do they need a refresher on how to administer the treatment? Do they need someone like you to be on the phone to walk them through step by step in order for them to be able to do that in the moment? There's different kinds of reasons why I might be a little bit uncomfortable, and solving some of these would be good. So getting on the phone to check in on the progress, how things are going, creating a safety net for the pet owners to be honest about how things are going and asking those questions so that you can provide the right kind of advice is going to be a good thing to do. And that's where our profession can shine. What would be good to send home are video tutorials on how to do this at home. Maybe your clinic has talented individuals that can create these videos for them, or maybe there's videos out there that you can look up on YouTube that you provide standard that you approve to your pet owners. I also recommend looking at official videos that are resources provided directly by the manufacturer themselves. The reason is because these videos are often made with a high quality production. They're professionally thought out regarding the key points that need to be conveyed to the pet owners. And there's also resources like printed material that can be provided to the pet owner, like a diary template that can monitor the different kinds of things that they should be paying attention to at home, so that they can bring that in on the follow-up visit to not have to rely on subjective memory in order to get a feel for how things are going at home. So, the key point here is to set your owners up for success by providing all these resources.
I love that. I think you gave so many great tips. And I know that most of us think, when we think about teaching an owner how to administer insulin, demonstrating it in the exam room. But you're absolutely right. Some people may kind of think that they understand more than they do, or maybe even pretend that they do because they don't want to admit that they don't. And then as a veterinary technician, I think it's really important that we're all cognizant of the different learning styles. And so many of the resources that you talked about address auditory learners, kinesthetic learners, visual, reading, writing learners. So yeah, we're covering a lot of our bases if we send home those resources.
Definitely true.
So how do we build trust with the owner so we have the best chance possible at successful treatment?
Yeah, I think we really should realize that our relationships and the foundation of building trust begins even before the pet gets sick. That most practices follow each patient from their first visit to the end of life, right? And so each visit and the conversations that you have with them are really great ways to start building that relationship and trust, because being consistently taken care of is what creates that trust and the credibility for you that allows you to have the harder conversations later down the road. Take interest in these people as people themselves, as human beings, not just as a client, since that's what will help you know what kind of communication style is going to be needed for this particular person. There are people who probably need to be handled with care, right? That they need a gentle approach because they're overwhelmed. Some people have a nervous side to them and maybe needs a slap in the face, not literally, but figuratively, with blunt communication so that they can be helped to snap out of it and focus on what's needed in that moment to be done. And so it's really your relationship with them and how well you know these people that's going to help you determine how to best communicate. On that note, the best communicators have these conversations with empathy. So the question is, do you? We should understand that while we see diabetic patients all the time, we know what's going on, what needs to happen. It's usually the very first experience that the pet owners have that when they bring in a pet and their patient is diagnosed with diabetes. So it can involve a lot of different kinds of emotions. It could be something like fear and guilt. So using normalizing statements, like many owners don't realize what's going on until they come into the see the doctor. Or, I had a diabetic animal and I had a hard time treating my pet at home too. So that lets them know that they're not alone in all this, that this is a common thing that does happen, and we're going to be there to help them through it. And so hopefully it'll ease any of those fear and guilt that they might have. The good thing is, though, that the pet owner is there, right? They're getting the help that they need, and they did the right thing by showing up to the veterinary practice. And so acknowledge that, validate that, let them know that you're doing the right thing, and build their confidence up. And so just remember that you definitely have a huge influence in the success of the pet owner. These conversations can be challenging, but it's very rewarding at the same time, because you're going to be helping them lead many, many years of healthy and happy lives. So be that educator, be the advocate, be a bridge, translator, and ultimately the cheerleader. You can do this.
Ken, thank you so much for joining us today. You gave us so many great tips on being a patient advocate, communicating with your clients, educating them, supporting them in all the ways that they need. And I just think this will be such a valuable talk for all the veterinary technicians watching.
You're welcome, and thanks for having me.
And thank you to Beringer Ingelheim Animal Health for sponsoring this Tech Takeover edition of Vet2Vet. Check out vetfolio.com for more of our V2V discussions on various topics in veterinary medicine. And remember, patient care starts with self-care.
Important safety information. Prozinc, protamine zinc recombinant human insulin, is for use in dogs and cats only. Keep out of reach of children. Animals presenting with severe ketoacidosis, anorexia, lethargy, and/or vomiting should be stabilized with short-acting insulin and appropriate supportive therapy until their condition is stabilized. As with all insulin products, careful patient monitoring for hypoglycemia and hyperglycemia is essential to attain and maintain adequate glycemic control and to prevent associated complications. Overdose can result in profound hypoglycemia and death. The most common adverse reactions were lethargy, anorexia, hypoglycemia, vomiting, seizures, shaking, dogs only, diarrhea, and ataxia. Many of the adverse reactions, such as lethargy, seizures, shaking, and ataxia, are associated with hypoglycemia. Glucocorticoid and progestin use should be avoided. The safety and effectiveness of Prozinc in puppies, kittens, or breeding pregnant and lactating animals has not been evaluated. Prozinc is contraindicated during episodes of hypoglycemia and in animals sensitive to protamine zinc recombinant human insulin or any other ingredients in Prozinc. For full product information, please refer to the package insert.